So you're excited about the movement into organizations and institutions. I mean, that's what you were saying.
Yeah, just the legitimizing of yoga therapy through these entities like the military, like the Mayo Clinic, hiring yoga therapists. But one of the things that's like most exciting to me is that it indicates that healthcare is widening its lens
Yeah.
and opening it up to sort of non-traditional, non-pharmaceutically based treatments.
Symptom-based, yeah, absolutely. I mean, we can take this sort of a systemic look. It's the symptomology is what happens, like from a yogic perspective, happens after the disease process has occurred. Like really, that process is occurring way, way down the chain, and then we start having this symptomology or dis-ease. And what do? We go to a doctor. I don't want to feel this discomfort. And so the doctor is there, and that's important, right? To help us understand it from an allopathic perspective, to help us alleviate our suffering, alleviate symptoms. And I totally agree with you. It's absolutely exciting that then they're going, and then how do we reinforce this pattern change? So we can really pull back the processes that drive the disease or drive the dis-ease further into the system. And that's one of the things that yoga therapy does, especially because we're starting to understand more and more and more how the nervous system, stress and inflammation are at the core, lifestyle, are at the core of some of these really bigger issues.
And that just made me think about how yoga therapy doesn't just address the physical body and the physical symptoms. And I like to say, yeah, we have a physical body, but like a corpse also has a physical body. And we have these other bodies that Western medicine doesn't address. And so one of those bodies is the pranamaya kosha, which is just our energy body. And the fact that yoga therapy even involves and acknowledges that body is super helpful to that lasting behavioral change that you were talking about, because when we integrate a practice or understand something on the level of our pranamaya kosha, of our energy body, like that's how you ingrain habits, is dealing in that realm. So maybe you could talk a little bit about the pranamaya kosha or any of the other koshas.
What I could say really to kind of lean into what you're talking about is that sort of the foundational lens of yoga therapy is one of holism. What has been sort of classical, and certainly I couldn't speak for an entire industry of traditional Western views, but there's sort of this peeling off, well, that's psychology over there, that's through the mental and emotional, or that's the physiology, or and trust me, I'm not downplaying any of that. It's important stuff. And even, how we look at muscles for a long time, right? We're just like, that's the bicep, right? Yeah, right. And so yoga, I agree with you, what's fantastic about their lens is the lens of holism. And so they're really saying there's an imbalance that's occurring. Where in the holism, at which level of that, is it pushing and influencing balance or imbalance along the other layers? So yoga therapy, as we are coming to know about it, like contemporary yoga therapy, says, we need to, and we can at this point, turn toward research-based Western scientific lens to support and reinforce the philosophical yogic views. And so like you're saying, pranamaya, that energy body or the subtle body would correspond or relate to the nervous system. And because it's a holistic system, we know that if you address one thing here, it's going to have an effect down here, and vice versa. And that is exciting.
Yeah.
You know?
And to kind of ground the idea of like what pranamaya kosha is and what a practice that relates to pranamaya kosha, that would be like breathing practices, right? Because breathing is one of these like, you know, pulsation processes that we have, like the circulation of the blood, and anything with like a pulsation is related, has some relationship to pranamaya kosha, and I know, and of course it also has a relationship to the mind and all of that. It's all connected, but just the fact that we can, you know, start to look at specific breathing practices as like treatment for
anxiety, depression, dysregulation. So we know that the breath is the front door, as it were, to vagal tone. And vagal tone, heart rate variability, all these more sort of Western lens, right? But as we go into the institutions, we can speak to pranayama, breath work, breathing practices, and we can speak it in their language, and we can also be confident because there is research that says, hey, check it out. If you do a breath that extends the exhale, we know that will improve vagal tone, and therefore all of the cascading effects around that, namely resilience. And this to me, like, yoga therapy excites me in this way. It's a different conversation. So as once maybe we had a conversation that was around illness arising, suffering occurring, how do we treat that? And then we had, you know, trauma arising or grief arising, suffering occurs, how do we treat that? And now we're saying it all is about resilience. And we are these sort of, we're fragile beings, aren't we? We're just humans. We're spiritual beings having this human experience. And the human experience is up for phenomenological, however it develops, whatever occurs. But resilience simply says that we have the ability to bounce back. And that is what yoga therapy can bring to the table. It's like, can you bounce back? Can you find, right, physical vitality again, Annamaya kosha? Can you find nervous system regulation? So joy, peace, contentment. Can you find your intuition? You know what to do. You trust yourself. You understand that. You can change your, on Manamaya, change the lifestyle habits that lead to these sort of behaviors that aren't supporting vitality. And then the last one, and people don't often realize that, we have within us a part of ourselves that is inherently joyful. At the very center, they say, is the Anandamaya kosha. And that joyfulness body within us, that it is untouched. It's unstruck, right? This is the anahata, right? Yeah, it's untouched by the, again, phenomenological, but the experiences of life. And that's why you see people and read books and hear stories about those who have had great suffering and still know that joy within them. And so this is really the process of yoga therapy. I think it's great. Western medicine is recognizing that we can support patients in along the trans-theoretical model around adherence to lifestyle changes. And that will become more and more important as, economics change, as we have this huge influx of the baby boomers coming of age and needing support. So having these doctors want to treat a patient and have it stick. They really don't want people coming back, and so they are turning to CAMP, which is alternative.
Ideally.
Yeah, but I think they are. Yeah. I think they are, and that's what you're speaking to is what's exciting about yoga therapy, and that's what's exciting is we can step in, be dealing with professionals. They're telling us, help us get this recommendation to stick with the individual so that they can experience more vitality and wellness in their life. And we're like, yeah, we're uniquely suited for that. So it's a fantastic collaboration when it occurs.
Yeah. And it's interesting that so many doctors are just like, as a blanket recommendation, just recommending their patients do yoga. Yeah. So it's like,
yeah.
This is like, yoga therapy is like, well, wait a second, like just kind of the blanket, and this is what people worry about when they think about sort of new age practices.
Right.
And they, are worried about things like spiritual bypass, which is in one sense like offering a blanket solution. Oh, you just need to do this one thing and everything will be fine. And so what is like yoga therapy's answer to that, worry of people about spiritual bypass?
Actually, there are different systems of yoga therapy, certainly. And so we as a school, practice school for yoga therapy, we're a generalized school, so we're looking overall at systemic change, so along those 5 layers of the Panchamaya. But some schools really are like, I'm going to tell you as someone who has studied this what to do these things, mantra, meditation, along the 8 limbs, let's say, and that's what there is to do. Okay, so I can't speak for all yoga therapy, but I will speak for my understanding of it. Bypass occurs when there is an issue that is causing suffering or disease within the system, and we don't turn to it to understand its message. We try to skip over and push, whatever pain or discomfort or disease, we kind of push it away. And it works for a little while, doesn't it? Affirmations work for a little while. And even in yoga therapy, we use affirmations as like NLP, as a way to change recursive thinking, change, the obsessed mind chatter into something that's useful. That is not all that's done.
Piece of the puzzle.
It's a piece of the puzzle because it's a holistic system. So from the teachers I've had in yoga therapy, and even in psychotherapy, when we hear or when we feel discomfort, right? When we feel that either within the body, in the mind, in the emotional body, that there's actually really nothing wrong. What is occurring is that there is a message arising for us to understand more about ourselves, ways maybe we need to apply compassion for self or others, so that we can sort of reclaim and integrate parts that may have been disowned or shadowed or pushed aside because we've judged them as just being unacceptable. But yoga says, guess what? You're whole. And wholeness really does mean everything. It means all the shadow, all the darkness, all the hurts, everything that occurred, and we bring it forward. And I'm going to add something else. So when we eat food, right, it goes in, there's a digestive process, and hopefully when the digestion is working well, we let go of what's not needed, and what remains we convert into vitality, right? Energy. Well, we also have a digestive system in the brain. And instead of food, we're actually taking in experience. And when the digestive system in the brain, the limbic system, which is the sort of that nervous system, amygdala, hippocampus, the parasympathetic nervous system, when experience goes in and digestion is happening properly, we're able to break it down, make sense of it, let go of what is no longer needed, and we convert what's left into wisdom. But when the digestive system is not working properly because of shame, judgment, this is a big one, especially in trauma work, the experience is too big to understand or break down, is that it cannot break down. And it does not convert into wisdom. Not that it won't, it's just not yet. And it kind of remains there and, chews away at us, and we feel it as upset. I'm upset because I'm upset at this, or I'm upset at that. But all of that is just, there's an opportunity for healing here, right? So that's the work at the Manomaya level, is to really break down all these experiences all of us, especially currently, have had. Break it down in a way that we see, you know what, we're okay, just as we are. You're okay, just as you are. And incorporate it back into that sense of wholeness, which at its core is joyful, loving, has perspective and kindness at the Manomaya level, Anandamaya level.
Nice. And I think of the word wholesome.
Yes, wholesome.